Hello. Is your heart doing well? Or is there a little problem? Today, I'm going to talk about the 7 signs that can appear in your body and indicate that your heart isn't functioning at 100%. We know that cardiovascular disease is the #1 cause of death in the United States and worldwide. Here in the US, it claims the lives of around 700,000 Americans per year, according to the American Heart Association. So, pay close attention. I'll divide this video into 3 parts. The first part is about the 7 signs that you can see in your body, which could indicate a heart issue. The second part will cover the 7 classic symptoms you feel when your heart isn't doing well. And finally, I'll give you valuable tips to help you prevent heart problems in the future. This will be a complete video, so stick around until the end because I'm sure you'll learn something new. But first, go ahead and like the video, because the more people like it, the more YouTube will show it to those who may not have access to doctors or hospitals. Also, share this video with your friends and family. Many lives can be saved with your help. Let's start with the 7 signs that might indicate your heart isn't doing well. The 7th sign is known as Frank's sign. I bet that after watching this video, you'll start looking at people's ears more carefully. Why? Because a small diagonal crease in the ear can indicate blockages in the coronary or carotid arteries, which supply blood to the heart and brain. This sign was first described in the 1970s by Dr. Sanders Frank. Not everyone with this crease has heart problems, but studies show that about 70% of people with this crease could have arterial blockages. If you notice this sign in a younger person, it's even more important to be cautious. The 6th sign is hair loss on the legs. This can indicate a blockage in the arteries of the legs, which might mean other arteries in the body, including the coronary arteries, are also blocked. The 5th sign is xanthelasma, those yellowish plaques that appear on the eyelids due to cholesterol deposits in the skin. While they're usually harmless and more of a cosmetic issue, they can be a sign that cholesterol or triglyceride levels are too high. People with xanthelasma have a higher risk of heart disease. So if you notice them, it's important to check your cholesterol levels. The 4th sign is the arcus senilis, a white or gray ring around the cornea. If you're over 60, this is often normal, but if this ring appears in younger individuals, it could be a sign of severely high cholesterol, increasing the risk of heart disease. The 3rd sign is cyanosis, a bluish or purplish tint to the skin. This can indicate that a part of the body isn't receiving enough oxygenated blood and may be caused by heart or lung problems. Now, the 2nd sign is ulcers that won't heal on your legs or feet. These could be a result of poor circulation due to arterial blockages. People with this condition often have trouble walking long distances without feeling pain or fatigue in their legs. Finally, the 1st sign is swelling in the legs, ankles, and feet. This swelling, also known as edema, can happen when the heart isn't pumping blood effectively, causing fluid to accumulate in the lower parts of the body. If you notice your shoes getting tighter or your legs swelling by the end of the day, it might be a sign that your heart isn't functioning properly. Now that you know the 7 signs, let's talk about the 7 symptoms you might feel when your heart isn't working as it should. The first symptom is shortness of breath. If you get out of breath doing simple activities like climbing stairs or carrying groceries, it could be a sign that your heart isn't pumping enough blood to meet your body's needs. The second symptom is a persistent cough, especially if accompanied by white or pink mucus, which could indicate fluid in the lungs. The 3rd symptom is shortness of breath when lying down, causing you to need more pillows or even sleep sitting up. If this happens, seek medical help immediately, as it could be a sign of heart failure. The 4th symptom is general weakness. If you feel tired all the time and have difficulty with activities that used to be easy, like shopping or climbing stairs, your heart might not be pumping enough blood to your muscles and tissues. The 5th symptom is waking up multiple times at night to urinate, which can happen when the heart isn't functioning properly and the body needs to eliminate excess fluid. The 6th symptom is intermittent claudication, or leg pain when walking, which improves when you stop. This symptom indicates that blood flow isn't reaching the legs as it should. Finally, the 7th symptom is chest pain. This classic heart symptom can feel like pressure, tightness, or burning in the chest. If the pain spreads to your left arm, neck, jaw, or back, seek help right away, as it could be a sign of a heart attack. Now that you know the signs and symptoms, let's talk about how to prevent heart problems. First, make sure you engage in physical activity regularly. Walking, cycling, and swimming are great ways to keep your heart healthy. If you smoke, quit now. Smoking is one of the worst things you can do for your heart. Maintain a healthy weight, as excess weight puts a strain on your heart and raises blood pressure. Eat a balanced diet rich in fruits, vegetables, fiber, and whole grains. If you have a family history of heart disease, it's even more important to get regular checkups. Don't forget to keep your cholesterol and glucose levels in check and monitor your blood pressure, aiming for 120/80 or lower. If you've noticed any of the signs or symptoms I've mentioned, don't hesitate to see a doctor and follow their guidance. Did you like the video? Share it with others so more people can take care of their heart health. See you in the next video.